The syndrome of the fingers, acute and chronic. Pain and swelling of the fingers are common complaints. It is usually due to cold or damp, painful obstruction syndrome, and is frequently caused by prolonged exposure to cold water or rain over many years. For example, farmers or cleaners. In acute cases, only local points are used. The main points are as follows: Baxi or extra points. There are two alternative locations for these points, and they are both effective. They are located on the dorsum of the hand, either at the end of the finger creases when the hand is fisted, or midway between the end of the creases and the metacarpophalangeal articulations. They are needled obliquely towards the palm of the hand. So this is the location of the extra points. Baxi. Li3 expels wind, cold, and dampness from the fingers. It should be needled at least 0.5 tsun perpendicularly towards the ulna, that is along the palm of the hand. It is very effective, and some doctors think that if this point is punctured deeply enough, up to 1 tsun, there is no need to use the Bakshi points. TB3 also expels wind, cold, and dampness from the fingers. It is also effective for hot painful obstruction syndrome. SI3 expels wind from the fingers. Similar to Li3, it should be needled at least 0.5 tsun perpendicularly along the palm of the hand. In chronic cases, the aforementioned points are also used and they are combined with some adjacent points. TB5 is an important adjacent point for painful obstruction syndrome of the fingers. It expels wind and stimulates the circulation of qi and blood in the fingers. One should obtain the needling sensation to radiate downwards towards the fingers. Lung 7 can be used especially when the pain is located mostly along the base of the thumb. This occurs frequently in old people when the invasion of pathogenic factors is combined with a decline of qi affecting the lung channel. In young people, it occurs in piano or flute players. This point should be needled obliquely downwards and the needling sensation should radiate towards the thumb. SI5 is effective in expelling dampness and is therefore particularly useful when the fingers are swollen. If the fingers are swollen, they can be lightly tapped with a 7-star hammer or plum blossom needle until they bleed slightly and mocks of smoke should be directed onto them. These are the local and adjacent points for the fingers. Case history. A 53-year-old woman presented with pain in the fingers, which had started 2 years previously. The fingers were swollen and already deformed. Before the pain in the hand, she had also suffered with lower backache intermittently. She had been experiencing quite a severe loss of hair for the past year, and her knees felt weak. Her tongue was pale and tending to be peeled, and her pulse was slightly floating empty. The pain in the fingers is clearly due to invasion of cold and dampness. It has now turned into chronic painful obstruction syndrome with stagnation of phlegm in the joints, as evidenced by the bone deformities. Initially, this occurred against a background of blood deficiency, which then began to turn into yin deficiency of the kidneys. The blood deficiency is apparent from the pale tongue, whilst the beginning of yin deficiency is reflected in the falling hair, weak knees, and floating empty pulse. This case shows clearly how one can often see in practice borderline cases between blood and yin deficiency that happen more frequently in women. Treatment principle. She was treated with acupuncture and herbs, and the treatment was aimed at removing obstruction from the channel, expelling cold and dampness, nourishing blood and yin. The main points used were Li3 and Bakshi extra points to remove cold dampness from the fingers, TB5 to expel wind, stomach 36 and spleen 6 to nourish blood, kidney 3 and bladder 23 to tonify the kidneys. Thank you for your attention.